Thanks, Martin, and well done on putting together a really good agenda and set of speakers and technology exemplars today for the conference. And secondly, well done to yourself and the team at the most recent Irish Medical Awards that you just mentioned there in the 4 awards. I think it's a great recognition and a great demonstration of what a small team can deliver and can only get better. So thanks and well done to you and your team on that. Just what I just wanted to talk through briefly, a few areas, just firstly to, and I'll come on to the technology aspect and the innovation, but as I stand back from our response to COVID so far, and it has been since January the 27th, since we've been at this, there's kind of probably 5 areas that I'm quite proud of from the HSE's perspective and Ireland's perspective in terms of where we are at. And very briefly, firstly is obvious, to state the obvious, the response by the healthcare staff, and I put that beyond just the HSE family and beyond just frontline workers, has been phenomenal, and I think has done the country proud. Second one, I just want to say is what I saw at the very start of this, in the middle of it, and right now, is a whole of government response to supporting the health system in managing through this pandemic. And that goes across all government departments, all agencies, all bodies, Defence Forces and Garda Síochána. I could have not sought and got greater support than we got during this pandemic. And I have many fine examples I can share with you to demonstrate that, but probably time is tight. But second thing I want to say is the whole of government response. The third experience that, again, I believe has done as well, has that from a public's perspective, I think the public experienced a much stronger and united health voice in terms of urging them, in terms of winning their hearts and minds. And I think that's a lesson for all of us for the future. And that goes not just beyond the HSE, beyond the whole of government. It goes to the private sector, it goes to GP practice, it goes to our pharmacists, it goes to all of the people involved in delivery of health or public health messages. And the lesson for me in all of that is, the public looked to the health system when they needed somebody to trust, and they got greater trust by that kind of singular voice and message coming to them. And that's not to say for the future, we don't all have different drivers or different things we have to represent. But across all sectors, the not-for-profit sector, I think that was exemplary. And the fourth area for me that I look back with quite pride is the issue of the pace of change and innovation that has been implemented. And I've said this a few times very publicly. I've worked in the private sector for 30 years and now in the public sector for the last 9-10 years. And I've never seen, people always put the private sector out as a great exemplar of pace and change and innovation. Well, I certainly have never seen so much change delivered by so many people for such great impact in such a short space of time than I've seen in the health system over the past 9 months or so. And that's just great. I could list off many examples of it, but that's what I've seen and I've experienced. What all of that has, the fifth area I'll say that what it has done, I think we've given the health system, the HSE, greater confidence about implementing change. We've taken a lot of the bureaucracy out of it. We've taken it out of PowerPoint. We put it into the services. We've tried things. And one of the early messages that I gave out to the system, and indeed gave to government, was that I believed that we were going to get 70% of our decisions right in this pandemic, and we most likely would get 30% wrong. And the reason I said that very publicly was I wanted people to go do and make decisions and implement. And we will all take the rap for some of the things that don't go well, and we'll learn. But that's the best ratio anybody can ever expect to get. And I wanted to unlock the system in that regard. What all of those 5 things for me have done, as the single most important thing for me, is strengthened public trust and confidence in the HSE. And we've been tracking this weekly, we've been tracking it monthly. And we can now very clearly see an increased trust and confidence in the public with the HSE. And I know it's fragile. I know it's only as good as your last kind of win or demonstration of it. But certainly we are tracking it, and we are going in on a much better base into next year, and that's good for us all. Just 2 or 3 things I want to touch on that do stand out for me in terms of that mobilisation, that pace of change. And I don't want to harbour on any particular initiative, but a few that stand out for me in terms of outcomes. And first of all, I think with the innovation we put in, I think we're seeing a much better integration between the acute system and the community system. Martin was presenting there about, shifting left into the community. Yes, we got some very significant extra funds from government to make it happen. But the way we really helped the acute system was investing in community. And I can touch on briefly in a moment where we are with all of that. But integration, I think, has happened much better in this phase. A couple of others I will just touch on are testing and tracing. And testing and tracing is also regularly the subject of much political and media commentary. But I believe we have a lot to be proud of about what we've implemented in the health system. As of today, we've now tested over 2 million tests on this island. We're one of the few countries who systematically have continued to test close contacts. Over 360,000 cases of close contacts are being tested on day 0 and day 7. Many countries, when they became overwhelmed, abandoned the testing of close contacts. We stuck with it, and I believe we have a testing and tracing and capacity system that's been enabled by technology that's as good as any in Europe. The second one I just want to touch on is the COVID tracker. And, maybe the HSE was not often recognised as being a leading edge in terms of technology deployment. Well, we did it on this one, that's for sure. And the source code now being implemented by many countries all over the world. Many countries in Europe and many states in the US, based on a HSE delivery of a COVID tracker, is fantastic. There's been other examples that Martin's going to touch on today, and indeed that we're going to present through today. And the one that I have been looking at with great interest has been what Martin's been talking about, the remote monitoring, the patient empower, because for me, what we've had to put in place, and the endoscopy capsule was one of them, what we've had to put in place very quickly was technology that didn't draw people into a vulnerable acute health system. And many of those initiatives were really good for us. Some led through technology, some led through remote clinical care. I guess just to reflect very briefly for you where we are now with COVID and what happens in the next phase, I think firstly, we should all look forward with greater hope and greater confidence, obviously with what's happening with the vaccine, and everybody needs it. It's been a long, tough year on everybody, but I believe we should look forward with much greater hope and confidence. Second thing I can say is it's very hard to find anything that's been good about COVID, but I hope I've listed some areas that I believe why it's been good for the health system. But as we head into winter, we are heading into winter in a much stronger position than we've ever headed into winter before. If I take the number of COVID cases, just to briefly say to you, in hospitals today, we have 215 COVID positive cases, and we have 31 people in ICU. And it is coming down, and we want to see it come down further before Christmas. But overall, we're in a stronger position with our hospitals. Our emergency departments are down about 15% on presentations and down about 13% on admissions. Now, you may say that's because of people not coming forward and reduced referrals. Well, that's probably some element of the factor. But what we can also demonstrate is right now, today, we're 70% down on our trolley count that we had last year. Our delayed transfers of care, so people who are clinically discharged from hospital awaiting a transition care bed, is down by 47%. Our nursing home support schemes, so people who have been awaiting for further home help support, who generally end up back in our acute system, is down from this year from 7,500 people waiting to 2,300 today, which I call a normal churn. That's a normal 4-weekly churn we'll churn through. So there's a lot about flow that has improved in our hospital system, and a lot about the community system stepping up to relieve the pressure on the acute hospital system. So for me, looking forward with the eHealth agenda, and I'm conscious of your time, so I don't delay too much. For me, looking forward to the eHealth agenda, I think there's been great exemplars in COVID that has given the system confidence. as I look at my structure of the organisation going forward to HSE, we've done a good piece of work this year, delayed through COVID, but we are implementing it in Q1 of next year. One of the lead roles which I'll have reporting to me is a role around a function around e-health and disruptive technology. And that's a kind of dedicated commitment to see enhanced investment in technology and the role that technology plays. Because I think during COVID, we've been able to, as I said earlier on, take it from the conceptual phase, take it from PowerPoint and make it very meaningful with the list of projects that Martin had up there and Ross is tracking. So that's one thing I think that's key for me. The final piece I will say that is good for us all, when I talk about strengthening trust and confidence of the public, I think it's also important that we have strengthened the trust and confidence of government, because I think what we have demonstrated during COVID in 2020 has been the capacity to invest the funds focused and wisely. And that's been clearly demonstrated by government, because if I take the winter plan investment that we've secured, it's 600 million euros. Last year, we secured 50 million euros. Our budget for the health service next year is up 3.5 billion euros, 21% increase on the budget for next year. That for us is a massive challenge and a massive opportunity, but it's equally a very clear demonstration, because it's been said to me by the Taoiseach and others that they see the role that health can play in terms of transforming people's lives, and they see what we've done in COVID is a great example of really making that shift that Martin spoke about during his presentation. So, closing message from myself: I wish you all the very best of luck, and to all the presenters today. I see some great innovation in the communications technology, the assisted living online there, the digital epilepsy, cardiac monitoring, and others that will be demonstrated today. I have my full support and endorsement. Look today. Thank you. Over to you, Martin.
Thanks very much, Paul, for a very inspirational talk, and thanks for your continued support of the whole sort of Office CIO and the digital transformation team.